Hello, everyone. My name is Malik R.A.I.N, and I'm the host of Health Awareness Talk. Today, we have R.A.I.N HIV specialist, prevention specialist, and outreach, Mr. Roberto Olmo. 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 Hey, how you doing?
I'm doing good, Malik. I wish I was an HIV specialist. I'd be getting paid a lot more.
Oh, I hear you on that bit. Could you tell us a little bit more about your organization, please?
Yes, R.A.I.N actually started in 1992. The founder's name is Reverend Deborah Warren. She saw a need for individuals living with HIV to get services during that time. This was a time when a lot of people were dying from HIV and AIDS-related complications, and also a time when a lot of hospitals, hospices, and care facilities wouldn't allow people with HIV into them.
Mm-hmm.
So Reverend Warren and a group of volunteers, they formed care teams that would basically assist someone living with HIV, and in some cases assist them have a good quality of life until they die from AIDS.
Oh, okay. With the rank, what exactly is your position again with the organization? So I'll make sure I got that right.
I'm the outreach and prevention specialist at R.A.I.N. So what I do is a lot of education in the community. I do HIV 101 to teach people about HIV, how to prevent HIV and other sexually transmitted infections. And then I also teach people how to live healthy with HIV. One of the most important things that I love about R.A.I.N is that we never demonize HIV and we never demonize any STI.
Okay, that's super. Now, on our last show, if you got the information, what diseases are treated? Well, let's go over first. What all STDs can be cured?
Chlamydia, gonorrhea, syphilis are curable. Hepatitis C is curable now.
Mm-hmm.
Herpes is not curable, but it's very easy to control. HPV, they have a vaccine that can prevent HPV, and also in some cases it can be cured. Also, HIV and AIDS, there's only been one person in the world cured from HIV, but at this point we're not considering it curable.
Okay, so Magic Johnson wasn't cured of AIDS.
Well, we're not talking about Magic Johnson. There was this man called the Berlin Man that was actually cured from HIV.
Mm-hmm.
He had leukemia, and the doctors were treating the leukemia, and the doctor who treated him knew that there's a population in Europe that's naturally immune to HIV.
Mm-hmm.
So he took bone marrow from a donor from that population and gave it to his patient, and after 5 years of living in a bubble, this man was HIV negative.
Wow, but the whole thing about it is that he's still hurting and all that other stuff, right?
Yeah, he's going through it. In a later interview, he said that he wishes that he never underwent that procedure and just stuck with his HIV regimen.
And that HIV regimen is only like 1 pill a day now?
Yeah, that's the newer one.
Mm-hmm. And with that 1 pill a day, you only have a 96% chance of, well, you have a less than 4% chance of passing HIV on to someone else?
Exactly. A lot of doctors are comfortable with saying a 0 chance, but because one person did catch HIV during that study, they have to say 96%.
Okay, 96%. So, all right, we're going to say 96%. So the chances of you, if as long as the person's taking their regimen, you're having sex with them, and y'all don't go outside of having sex with each other, your chance is literally 0 catching HIV. Am I right?
Basically.
Okay, all right. So a lot of people out there may not know that, but if you use condoms like you just demonstrated in our last video, then more than likely that would be a 0% chance, right?
Yes, basically, condom usage is 96% effective, and then you combine that with someone who's undetectable, that takes it down another notch, and then also if the HIV negative partner's on PrEP, that'll be a very rare instance in the universe if that person becomes HIV positive.
Okay, Roberto, I got a problem. Okay, my problem is that PrEP is $1,200 a month.
Mm-hmm.
I can't afford $1,200 a month. I'm sorry. Okay, I mean, what's the guy? And how much is the HIV treatment?
That can range about $2,400 a month.
$2,400. I can't afford $2,400 a month. So what is a person to do?
So if I want to be on PrEP but I can't afford it, most likely the insurance policy I'm on will cover PrEP. Also, the company that creates PrEP, Gilead, has a lot of copay programs that will basically make it affordable or to get it to a point where I probably won't have to pay out of pocket.
Okay, do you take PrEP?
No.
Okay. Does your insurance qualify you to take PrEP?
Yeah, my insurance will cover it.
Your insurance cover it? All right, was it covered 100% or what?
I believe there is a copayment on it, but luckily the company has the copayments covered.
Okay.
So most likely wouldn't have to come out of pocket.
Okay. Well, let's say if you did have a copayment for PrEP because you fell in love with somebody who's HIV positive or whatever, and you just want to protect yourself for whatever reason. If you're taking PrEP, okay, so if you're taking PrEP, so even if a copay would probably be how much?
I can't really give you an exact number because that would be someone who would have to fill out those insurance forms.
Yeah.
But what I do know is that whatever the insurance is not covering, the company who makes PrEP has copays that are generous enough to either knock it all out or knock most of it out.
Okay. Now, the whole thing about PrEP is once you start taking it, will it affect your health in any way?
In the beginning, they want to make sure that you have healthy functioning kidneys.
Mm-hmm.
If you do have any renal problems, they probably won't want you to be on PrEP. But what they'll do is they'll observe your kidney function at first, and if everything goes well, then you can continue using PrEP.
What's the renal problem?
Like if your kidneys don't function as well as someone who has healthy kidneys.
Okay, so renal has association with kidneys, right?
Mm-hmm.
Just for those people out there who just didn't know. All right, so we know that there's a treatment program out there for PrEP for a person, which keeps it, your capability of catching HIV is, if you're taking PrEP, is what percentage again, Roberto?
It's 96% effective.
It's 90%, 96% effective. If you want to spend $1,200 a pill, $1,200 for a month for a regimen that's going to help you to catch it. It's going to help to keep you from catching HIV. And then we also have the other treatment. If you are HIV positive, it's going to run you $2,000 to $2,400 a month. Does your organization R.A.I.N help out with this in any way?
Let me backtrack a little bit. So most likely, most insurance companies will cover most of PrEP. Most people will not be paying $1,200 a month unless you're really rich. And the thing is, with HIV medicine, a lot of insurance companies cover HIV medicine, and also there's a program by the federal government called R.A.I.N that will pay for HIV treatment and also care and medicine for individuals who cannot afford it.
Okay, Roberto, how does somebody get in contact with you to get more information for free medication for HIV?
You can look up the R.A.I.N website. It's www.carolinarain.org. You can call me at 704-973-9814, or you can shoot me an email at r.olmo@carolinarain.org. Okay,
super. So a person coming over to the R.A.I.N organization, Roberto, what are they to expect once you get there to your building?
So if we have someone coming in that's HIV positive for the first time, the first thing that we'll do is we'll ask them how old they are. We have a youth program for youth living with HIV ages 12 through 25, and then we also have an adult medical case management program for adults 25 and over, and that's also where we have our seniors. Also, we take into account if they're able to speak English. So if they speak Spanish, we'll link them directly to our Spanish case managers. You'll come in, you'll do what's called an assessment, and what that assessment will do, intake and assessment, and we'll just kind of see like how you're feeling around your HIV. We'll get a few releases from you, allowing us to speak to your doctors or act on your behalf, connect to a doctor, also fill out your insurance forms for you to make sure that your medication is covered. And then you'll also be linked to any of our support services. We do psychosocial support, and we have a lot of support groups here at R.A.I.N. And then we'll also connect you to other agencies within the community that can also help support you around your HIV. And we also assist with transportation, assist with linking to housing if you're homeless or in an unstable environment. If you need to speak to a mental health specialist, we can connect you to that as well, and a whole multitude of other services.
Are they all free?
And they're all free.
Okay, and that's the biggest. You know, one of the biggest things that stop most people is they always think it's going to cost them something. You know, and you know when something's that serious out there, and it's another reason that we're doing the show. We're letting people know that just like the health department is out there to help you, we have organizations out here such as R.A.I.N. that's out here to help you as well. And where does the name R.A.I.N. come from, Roberto?
R.A.I.N. stands for the Regional AIDS Interfaith Network. So interfaith, that part comes from the fact that R.A.I.N. actually started in faith-based communities.
Okay.
But we don't have religious affiliations. Though.
Okay. All right. That's super. Roberto, how did you become a part of the R.A.I.N. organization?
I actually started off as a client. I was diagnosed with HIV when I was 23, and I was in the youth program. And Miss Chelsea White, she was my case manager at the time. And I remember I always told her, I was like, Chelsea, I have a degree in biology, and yo hablo español, so why don't you try to put me on the payroll? And it was until like a couple of years later she called me up and was like, hey, apply for this position, and I knocked it out the interview, and I've been here since 2013.
Okay, so you're HIV positive as well?
Yeah.
That's what I'm saying. You can never tell by looking. You know, just see a handsome guy like yourself walking down the street or something like that. You just never know. How is taking that treatment? Did you have any problems or anything?
No, none at all.
Okay.
The only, I think with my first regimen, it was a 1-pill J2. I'm still on a 1-pill regimen. I probably just had a few weird dreams the first month, but then that was it.
Okay. Are you paying $2,000 a month?
Oh, no. When I first started, I was under R.A.I.N., and R.A.I.N. covered everything. And then when I started working full-time and got insurance, my insurance covered everything as well.
Okay. Do you find it it's a lot more accepting of folks finding dates and stuff out there? Is it a lot more acceptance for people who have HIV, do you think, in today's time?
HIV is a little more accepted in the gay community than it is in the straight community. Because the burden of HIV happens to fall on the LGBT community, people within this community are a lot more accepting and know how to react more when someone discloses an HIV positive status and are more willing to pursue a relationship with that person. It's a different ballgame in the straight community, because in the straight community it's like, it's all of a sudden like, oh, who were you sleeping with? How many people have you been sleeping with? Also, what crazy kinky stuff have you been doing? That's like the first reaction. And we do get some of that in the gay community as well, but not as much or as harsh in the straight community. Also, HIV in the straight community is demonized a lot of the time. Automatically assuming and slandering that, that somebody is gay because they have HIV. That's part of the stigma. Or like, oh, they were running around on the DL. DL is like a big term that people will accuse HIV on and stuff. And also the case is a lot harder for the kids that were born HIV positive. a lot of them are growing up now. They're teenagers. A few of our kids in our youth program are beautiful, young adults, young teens. And HIV doesn't really have a specific face. So I could not imagine HIV in high school. But these kids, they're living it every day. And they want to date. They want to like have healthy, normal relationships, and it's very hard for them because imagine being a teenager, and you're forced at the age of 12, 13 to like, if you want to start dating, you have to start like disclosing right away and stuff. It's really different for someone who was diagnosed in their 20s or 30s because we knew what it was like to be negative, but those kids never knew what it was.
Okay, that's super. Roberto, somebody, whoever gave you HIV, did you have any negative feelings against them when you first found out?
The reality is that I don't have the type of story that that I can blame and push it on one person. I knew from Jump Street I was irresponsible. At the end of the day, my body was my responsibility and not theirs. I know that with my case, I got comfortable not using condoms with one guy. And then that made me comfortable not using condoms with the next one, and the next one, and the next one, and so on. So I knew from Jump Street that I wasn't a victim here.
Yeah, you own it, right? You own it, and that's the very first thing. Everybody got, regardless if you're straight or regardless if you're gay, being protected is your responsibility and no one else's. Okay? You don't trust, how that saying go, you don't trust anybody except your mama, even then you cut the cords, So, you got to make sure you take it, especially when it comes to sex. You got to make sure you understand you are the one responsible for your life. You have to make the choice to choose life. Wear a condom, okay? Wear some type of protection. And if you know you're going to have a promiscuous life out there, go ahead and spend that $1,200 a month, okay? For that PrEP pill or get whatever that you need. All right, any passing words that you want to give us, Roberto, about the organization or about yourself, or to anyone out there who may be HIV positive, to help to make them make a better life or anything?
Yeah, so I want to encourage everyone to get tested for HIV. If you test negative, you need to know how to stay negative, use condoms correctly, talk to your doctor about PrEP, and also make sure you get tested at the very least once a year. If you test positive for HIV, the first thing I want you to do is to not panic. HIV is a very easy chronic condition to manage. The regimens, the newer ones, like I said, is 1 pill a day. There is no longer a life expectancy on HIV. You're going to live a very long, healthy, normal life as long as you keep taking your medicine and getting the support that you need.
Okay, super. Everyone, you heard that. That is Roberto Olmo with R.A.I.N. He's the HIV prevention and outreach specialist for that HIV organization. Thank you, Roberto.
You're welcome, Malik.
Okay, super. This is Malik R.A.I.N, host of Health Awareness Talk. Everyone, have a wonderful night, and thank you. And that ends it, 4-part series.